each other. All right. So, hello out there in listener land. Welcome back to another episode of Therapy Without the Couch with me, Dr. G. The always disclaimer, this is not therapy. I'm not your therapist. This is just a clever name to get people interested in a podcast and learn a little bit more about therapy. And today's episode is special for two reasons. One, I am joined by guests, which I've only done once before, and I'm going to introduce them, and they'll introduce themselves in a moment. But this is also our first crossover episode. This is like, it's like Meredith Grey and Dr. Robbie are getting together. We're gonna do, right? So,
Right. Gabby here from the Counseling Corner, the other podcast that we have from Cora Gables Counseling Center, which is the group that Dr. G and I both work in. And I'm excited to be here.
thank you. And who else do we have joining us? Introduce yourselves, please, briefly.
Hi, everyone. I'm Bianca Gabay, a registered mental health counselor intern. This is, I guess, year one that I'm here at the Coral Gables Counseling Center, and I'm delighted to be here with these other beautiful professionals.
It is a beautiful room, right? Like, wow. Okay.
Hello, I'm Tiffany Perez. I'm a licensed mental health counselor, and I work with the group at Coral Gables Counseling Center. I have the honor of getting to work in near the distance of these people here, these wonderful professionals. Happy to be here. Excited.
Thank you for joining.
Thank you.
And so, what we're doing a little bit differently today, folks, is I think there's a lot of preconceived notions about therapy. And I worry that if you haven't done therapy, you don't understand that it can look like a lot of different things. So, what we're doing today is sort of almost like a speed dating version of what if you could meet each one of us, if you could interview us and say, which one of us would you want to be your therapist? You're going to see that we all do it differently. So, it's not just looking at the title, the degree, where we practice, or just that we all do quote unquote therapy. The question then becomes, well, which style, which person do you like? So, the way we're going to do this, we're going to start making it a little bit formal, almost like a quiz. And then we'll switch to chit chat, and we're all going to step on each other's toes and criticize each other. But what would we do if we all met Maria? So, our case today, Maria presents to us with symptoms of low self worth, lack of energy or motivation, trouble sleeping. She feels blah. This is the type of thing that somebody would call and request help about, and that's all we've got to go on. She's never seen a therapist or psychiatrist before, does not want quote unquote psych meds, and she's questioning her marriage. What we find out in the first few minutes of the interview is that she's a 41-year-old married female with a 4-year-old son. She formerly worked in marketing, stopped working since her son was born. She goes running 2 to 3 times a week. She's originally from Spain. She's been here in the US for 12 years. She's been married 10 years. Her spouse is Jewish. He's from Chicago. So let's see how we would all approach this case differently. Should I go first since I'm already holding the mic? Or...
Do it.
All right,
Do it.
okay.
Let's dive in.
All right. So the way I would look at this, guys, is I used to work in hospitals and medical settings. And so I'm trained as a health psychologist. And right away, I look at this and I'm like, all right, what's going on with her medically? Because I'm looking at age, I'm looking at she's had a kid, I'm looking at this feeling of blah, like what that could be so many things. And yes, it could be depression, but then I want to know, like, what's your dietary intake, or where you're at in your menstrual cycle, or you're perimenopausal. What's your fluid intake like? Are you taking supplements, drinking caffeine, alcohol? Like, what's going into your body? And then I would also want to know, how do you cope? That's always one of my first questions in session. Like, what are you doing? So she goes running, but like, okay, what else is going on there? And are you running to cope, or are you running for other reasons? Then there's this career piece. And I'm dying to know, okay, well, do you want to get back to work? Why did you stop work? Do you feel like you lost yourself? I mean, I could go on and on with that one. That was jumped out at me. And then something I also jump into here is the kind of the whole self, what I call the health 360 approach. Like, I want to know, as you see, I'm asking about health, but then I want to know, what's your career like? I want to know what your social life is like. I want to know if there's a financial disparity. If you're working and husband's not, then is that a factor? He's Jewish. She's from Spain. Okay, are you Christian or Catholic or religious? Is there any issue there? How are you raising your kid? Are there co-parenting issues? Maybe that's why we're feeling a little blah in the marriage, right? Like, when did the marriage blahness start? Does that resonate with any of y'all?
Yeah.
Right? Will we do similar things?
Absolutely.
Or where would you do it different?
So I think for different reasons, I also always dive into health because I know I struggled a lot hormonally and with health issues, and that affected my mood personally a lot, which I think has actually helped me in therapy because I then jump to that. And it's something I think of often with my patients, male or female. Like, what is going on with you health wise? And it really does make such a huge difference. And coming from a personal place, which I'm sure you seeing it so often in that field. So that is also something I dive into, but I definitely do a little deep dive into how someone was raised because it does sound like Maria specifically is being pretty hard on herself. The low self worth is something that always sticks out to me because I do think that our internal dialogue, our narrative makes a huge difference in how we view the world. And like the science behind that is so powerful. There's so many studies about it, about our reticular activating system and just how our brain works and what we're telling ourselves. So I would really want to know how she was raised, what she was told, and what she's taken with her, right? So what does she tell herself now? Like, what does she say when she looks at herself in the mirror? You know, how does she feel when she wakes up? Does she get dressed up? Does she stay at home in her PJs all day? Like, when was the last time she got her hair done? Seems silly, but it makes such a huge difference in just overall mood and how you feel about yourself will dictate how you feel about almost everything around you. So I would definitely do a little bit of a deeper dive into that.
Interesting.
Yeah, and it's funny.
Wait, let's say who's speaking so that way the podcast listeners. So who's on the
Yeah.
mic?
Tiffany.
All right, hit it.
And this was Gabby.
Get it, girl.
My first takeaway is what to touch on what Gabby was saying. The difference with doing a case study like this versus like seeing a client in person. You get a lot from observations that you see right off the bat, right? Like, so how she's presenting herself in the session right then and there. Is she put together? Is she kind of like just barely making it through? Like there's a lot you can tell from physical appearance. Another thing too, like a part that I would touch on, the 4-year-old. Having a 4-year-old is a still pretty young kid. Being at work or leaving work to be a full-time mom, like I would wonder, postpartum, like that's still something that can be like lingering on.
And there's late onset postpartum too. That's a thing.
Okay. See, I didn't even know that. That's
Yeah.
and
I
that's
found it
terrifying.
in a
That's
session.
terrifying.
Yeah.
But no, that's a big part of it, right? Like, how is she coping with being a mom? Like, there's a lot of like feelings of guilt, and am I doing enough? And pressure and society of like, what should I be doing? Should I be working? Should I be doing both? Juggling all these like hats. The marriage thing is a big one. She's been here for 12 years from Spain, and that already is a huge like cultural shock. And then her husband married for 10. So my question would be, did she meet him here? Did they date prior? He's Jewish, so is there any pressure for her to like have to convert to Judaism? Because that's a big thing in that culture as well.
And just the cultural differences in general, right?
Yeah.
Like having lived in Spain your whole life, did you come for a job or did you come for him? Like how, and then once that job was taken away and you had to like dive into this society, how did you take that, right? Are you away from your family while raising your child for 4 years?
Exactly.
There are very huge cultural differences between Spain and the US,
Absolutely. And the support thing is a big one that I always touch on. It's one of my coping skills that I go for with clients is, what do you have here? Like, do you have friends? Do you have hobbies? Do you have, a community outside of your husband, outside of being a stay-at-home mom? 'Cause that's very isolating too.
Well, and then the childcare piece, because then what I often see is folks want to get either back to work or just get to living life, just doing something. But if the kid's 4 and maybe isn't in pre-K 4 or something yet, then like if I don't have grandma and grandpa or a nanny or somebody, then where's the kid going to go if I want to go be me again?
Exactly. It's all consuming when you become a mom. So 4 years old, they should be hopefully starting, pre-K or kindergarten, really. So then that like opens up a lot of time. So I wonder like her structure of her day, her routine, what does that look like? Because that's really important too. You're going to bed. I think one of the things you mentioned was trouble sleeping. So like digging into her nighttime routine. A lot of the time we like spend hours on our phone, even right before bed, and that can be like insanely not, I don't want to use the word triggering, but it could be, something that really works against our,
Yeah.
yeah,
The blue light.
our intent to fall asleep, right? To relax, to unwind. A lot of people say, "Oh, I use my phone to unwind at night." Really? you're you're like turning
bombarding your brain with
fight or flight
information.
on is what you're doing.
Yeah,
there.
exactly.
That's not a good plan. But I don't know, Bianca, if you want to
Sure.
touch on some stuff.
Yeah. Hi everyone, Bianca here. Um, I love everything. Well, first of all, I've never heard of a client like this ever. I feel like I hear a lot of women probably in pockets of dealing with these certain presenting problems and issues. But nonetheless, I'm a relational therapist, so immediately my mind goes to first and foremost, what's her relationship like with herself? How does she treat herself? What are some of these narratives that she lives by, and the expectations that become almost knee jerk and automatic? How she shows up in her relationship with herself, in her relationship with her partner, in her relationship as a parent, um, which often run the show without any real conscious, deliberate kind of pause and thinking about what could I be doing differently. So that kind of comes to mind first. And then I would dive into the system. I'm not trained systemically, but I am, I guess the modality that I'm trained in is a systemic family systems approach. And so I'm wondering like what's the dynamic going on in this household? I think like what you guys touched on about support, like what resources does she have, and what's it like for her to even ask for help? She comes from a Hispanic or a Latin culture where women maybe asking for help isn't as that common, I should say, maybe to be able to ask and not feel the self-sufficient that I can do it all myself. Um, so I think there's so many threads to pull at here. But I want to say I love that you guys all touched on, and you, Dr. G, on health. Um, I think it's definitely a precondition that could get in the way of her having, more of a content or fulfilling relationship with her partner if there is an undiagnosed depression or anxiety, or postpartum depression. So I think everything you guys said is all just really rich.
But isn't it, I mean,
Yeah.
we're all touching on the same kind of thing, but we might do it differently.
Right.
Like
Yeah.
whether you're looking at the relational piece or whether you're talking about what is it that you said? It's something that grabbed me there. The family of origin, kind of like
Yeah.
what's the early messaging,
Yeah.
right?
Yep.
And I mean, I think that's what we're all sort of like the overlap here. I didn't say this. I meant to have us all talk about our theory, and I got very excited. I started talking. So we'll do that in a minute out there in listener land, so you know what we're working from. But yeah, I work from a feminist theory, and that it becomes very much about what is the system, meaning broadly speaking. So like as a woman in America, where does that sit you? And as a woman who's not 20 in America, like, and what is the cultural what is the system in the house and where the power dynamics play in? And that's where I brought up the finances piece. So I'm always very curious, kind of like where you sit in the like bigger picture, and you start in your home unit and you branch all the way out to like politically and socially and environmentally and all that stuff. So I think that's a big factor that we can't kind of overlook. And it's so often we look at the person, but like, okay, it's the person in context. Like you might be fine if we
Right.
plucked you out and put you somewhere else.
Sure.
That's actually my weird way of dealing with suicidality with patients that I ask, okay, do you want to die or do you want to not live this life?
Right.
Like hypothetically, if I could put you in a different life, is that maybe look different? I mean, obviously it's harder to do than to say, but
Mm-hmm.
so yeah, let me do that. Okay, like just so people can
Can I just
understand.
touch on what you just
Oh
said?
yeah, please. Yeah.
With regards to the feminist theory, I mean, I guess Bianca here, I'm happy to say that I'm certified as a relational life therapist. I deal with individuals and couples, and it is leaning on the shoulders of feminist theory. So Jean Baker Miller, Caroline Gilligan, she's a big one in this field, um, as well as systems theory. But you said something really interesting about how she as a woman views herself, and now as a mother I'm wondering what has been the impact of her role as a mother on the relationship, like how maybe now
the husband feels disengaged because all her time and attention, and he's putting out a stink and doing what he's doing in response to her new role as mother. So it's just kind of fascinating how it all interplays. It's very rarely one thing, and that's something I find that is one of the best parts of working with humans, right? That you never do the same thing twice. There's never anything more ever different and ever changing than like humans. Like I'm never bored, ever bored in sessions, or at least very rarely. You know, there's people I see for 4, 5, 6 years, and there's always something new happening. And I think in these situations where someone's married, I always wonder, like, do you still love this version of each other? Like, were you able to grow together or did you grow apart? Because that's, I think people always assume, like, I know what she needs, I know what he needs. Like, the longer you're together, that the more that assumption is at the forefront of your relationship. Like, I shouldn't need to tell him or her this, they should know better. But that's the biggest. Am I allowed to curse?
Yeah.
That's the biggest bullshit that you can find, you know, in relationships. In reality, I am not the same person I was 5 years ago, 10 years ago. God, who is she, right?
Right.
And so if I'm with a partner that's not willing to continue conversation and getting to know me, we're going nowhere fast, you know. And so I wonder with Maria, our patient here, if you know her and her husband have been able to commit to that, you know, evolving together.
Yeah, with that flexibility and curiosity.
Yeah. I was gonna touch on, you know, you and I had mentioned we like ran into each other the other day, Dr. G, and we were talking about a case, and it's like we're almost like maybe I've watched too much psychological thrillers, but I feel like I'm a
We all-
detective on the case. Like every time I have a new client, right? My job is to like dig deep and find the clues and like connect the dots, and because a lot of the times we as you know people, our lives are so convoluted with relationships, with work, with all these hats that we put on that we ourselves lose like sight of the big picture and we lose sight of what's really like at the core of our issue. So when you come to therapy, it's nice to like have someone like an objective view outside to like kind of pinpoint and be like, have you thought about this? Have you tried this? You know, because like what Gabby says, like you know, we're ever changing and growing and hopefully, right? That's the good thing, right? It's like as long as you're growing and changing, that means you're doing something right. And so sometimes we lose track of our journey or like where we want to go. You know, I don't know if we're talking about our theories.
Yeah, hit it. Yeah, where are you coming from?
Let's dive into that.
Let's dive in. Let's dive in. I feel like I have a sexy baby radio voice. I have
You
a little
really
bit
do.
of a rasp.
You
really
so,
do.
The
Well,
perfect
this is
zig.
Who you been yelling at?
Welcome to the late hour.
That was a
Late night.
The Dr. G spot.
Oh my god.
Oh, it wouldn't be a good laugh unless it was
We
Like
gotta
Abby
snort.
snort. Oh,
We
you're
gotta
welcome.
keep- yeah. Now it's real.
No, I lean into more of like an existentialist view. So I'm always, you know, trying to go to that big picture, right? Like our search for meaning or purpose in life. I really think that it comes down to that. A lot of the times we get boggled down with all the baloney, I'll say, of social media and like, you know, oh, what car do we drive and what do we wear and this and that and blah, blah, blah. And at the end of the day, it's like you take all that away and then what do you have, right? You need to find something that drives you, something that makes you want to wake up every day and feel excited to be, you know, like live and be present in everything that we do, you know, from the food that we're consuming, from the people that we spend our times with, like all of that. So I love that perspective from like Viktor Frankl, you know, like he was a Holocaust survivor and he wrote a book, Man's Search for Meaning. So that's like one of my, you know, one of my tattoos is like a quote from him.
I love that.
You know, yeah, it's like
On my bedside table.
Oh yeah, yeah. And I
The life
recommend
of
it.
therapist. This is
Right.
our casual, superficial life.
Tattoos of quotes and
Yeah.
bedside
Right,
table
right.
books.
Holocaust survivors.
I know. It's dark, but it's comes from a place of like we can't forget that, right? We have to remember the suffering is what really the I'm trying to remember the quote now off the top of my head. It's like what is to give light must endure burning, right? So what does that mean to
Mm.
you, right? It's something that I actually tattooed right here on my front because I feel like it's almost like I'm promoting that to my clients, right? Like
Mhm.
through our suffering is where the true like change and growth and evolution happens. So it's unfortunate, you know, we don't, but maybe it is something that we have to like be appreciative of, like those times that we go through difficult situations, events can really like bring a new perspective and give us a light that we can look forward to. Yeah.
Absolutely.
Well said.
Can I touch
Please.
on what you're saying? I think that what I just heard you say is talking about so many adjustment periods, and with the case of Maria, she's gone through quite significant adjustment stages of moving to a new country, marrying into a different religion, having a child, changing careers, or wanting to get back into the career world. And I think the topic of grief should really be discussed, and how much of that has been metabolized. And I think for her that she's at a real crossroads, and where with time on her hands but not so much, and just kind of this reevaluation, and probably leading to a lot of the blah.
Well, and you used the word grief, which I think is more impactful. But what I was thinking with our made up case here is it's a sometimes I with patients I have to give the safe space for you to say the thing that you don't want to say out loud that like maybe isn't socially acceptable. Like maybe you thought moving to America was going to be great, and now you miss home.
Mhm.
Maybe you were looking forward to being a mom, and now it's like not as fulfilling as you wanted, and you're not supposed to say that.
Yeah,
And so there's almost like grieving the expectation
that's
or the
exactly
hope,
right.
or this is not what I. And maybe her husband and her not connecting because they thought this was going to be this amazing life together, and now they've grown apart. But like I think a lot of times we come in with this idea and we almost don't want to let go of it because then it's like admitting I was wrong, and it's a little bit of existential meaning making. But like, okay, this isn't what I thought it was, but can I accept it for what it is, and then what do we do from there?
And
I
there's
think so often,
uncertainty in the not knowing of what it should look like.
well, because I thought I knew what it should look
Right.
like, and I'm looking around and it doesn't feel like that.
That's
So
right.
now, I assume I'm wrong.
Yes.
But sometimes it's not me. It's just like nobody told me the full deal, or I wasn't really looking at it with open eyes.
And almost like we tend to, and Bianca and I touched on it. This is Gabby, by the way. How we speak to ourselves makes such a big difference, even in that case. Because if you're incapable of being like, "Man, I screwed up. Like this isn't what I thought, but that's okay. I'm gonna move forward. I'm gonna take this new experience that's very different from what I thought and make the best of it." A lot of people are incapable of doing that. A lot of people are so trained, it's so habitual, like we're so habituated to uh being unkind to ourselves that we're like, I messed up. I ruined this. I screwed this up. And now I have to put up with this crappy life that I didn't want. And that mentality makes such a huge difference. Like it can make or break the life that you're living. So that's a big thing that I pay attention to in my sessions where I'm like, she's describing it this way. So I tend to do a lot of like, all right, give me the glass half full view on this. Like, and sometimes they are literally incapable of coming up with a different narrative, of coming up with a different story, because our lives are based on the stories we tell ourselves, you know? And so if your cup of coffee screwed up your whole day, and it wasn't just like my cup of coffee made me change into a cuter top, and then I went on with my day, like two different stories, 2 different days. So it's just something that is always sticks no matter what it is we're talking about. And so in kind of backtracking a little bit, because we were going to talk about what we work with,
Where we
right?
come from, yeah.
So I have never been able to stick to one thing, much like in my life in general. But because people are so different, so ever changing, I can't commit to one thing. I will say that in almost, and that's just not to say every, because I can't off the top of my head think of them all, but in almost every session that I've ever had, or with almost every experience with every patient, I have worked on their narrative and their internal dialogue. Like that is something I work on with every patient that I have currently, at least. And I think it changes big parts of it. But I do a lot of family systems, and I work a lot with CBT and narrative therapy, like I was saying. But I really pull from so many different areas. And I was lucky because I started working in this office in my undergrad. And so I've been working in the field for 15 years and hearing so many different things for so long that I can see such good in so much of it.
Mm.
So I can't say I'm married to one thing. And I think that's why I also am not married to one niche, which, you know, keeps things interesting.
You have things you like to work with.
For sure, I have things I like to. I love working with trauma. I love working with self-esteem issues. That is one of my favorite things to work on, and I think most people deal with it, you know, struggle with it. And I worked at a domestic violence and rape crisis center. So that is one of the things that I work a ton with, you know, survivors of domestic violence and rape crisis, and how kind of shifting back into a normal life after that is so, so difficult, but so rewarding for them and for me. Selfishly, right? We love to see them thrive. I like working with addiction too, which is funny. Something I thought I wouldn't like working with, but once I started working with it, I loved it. And yeah, the day to day stuff too. You know, what people call first world problems, and I always say that because therapy should not be like, oh, I don't need therapy. Like I'm just feeling a little sad right now. Therapy doesn't have to be something you dive into and go on. Like I saw my therapist for 5 years weekly, and now it's like on an as needed basis. And that's how I like to tell my patients, like, we're done for now. You're good right now. But if next week you feel like crap and you need me, text me and I got you, you know?
Mhm.
Or like if 2 years from now you're struggling with something, I'm here. So I love the as needed basis mentality to therapy. Like if you're going through a struggle right now, maybe we'll only do 2 sessions, but you'll have my name in your phone. And
Mhm.
if you ever need anything again, you can call me up and I'm there and I know your history and we dive in.
Yeah, I love that.
You know, before we move on to other folks, I do want to clarify. I didn't say this, but now you made me think I should say. I work at it was technically an integrative method, meaning I steal from everything. But I've never really said this out loud. It's on my website, but it feels so like dorky. But I call it the Dr. G method because I've sort of compiled, like I do the
But
same
that's what
thing.
it is.
It
yeah.
is. It's my specific like special sauce that maybe it's almost exactly what you do, but I have a little extra hot sauce and a little less onion. But it's like my right and like that's what I do, but it's not, it doesn't fit in one box because I feel like you come into me in my session and you need whatever. And I'm like, oh, well, what I was going to do for Susie isn't going to work for Maria. So I got to pivot. But I don't know. I feel like when we were in school, I don't know, depends on what y'all did, but we were taught like you have to pick literally
Yeah.
week one.
Yep.
Introduce your name. What is your name and what is your modality? And I was like, bro, I haven't read the books yet. It's
Yeah.
day one. What are we talking
Yeah.
about? Like you were supposed to commit. And it was like naughty to say that you were eclectic or
Eclectic,
integrative.
yeah.
Like that means you can't pick. That
Yes.
means you didn't really learn.
Yeah.
But I
Or
don't
like
know.
the idea that you need to be a
Yeah,
blank
exactly.
slate.
Yeah. Which is why I
Oh yeah,
advertise
I'm a
it's
terrible blank slate.
Psychoanalysis,
I was
right?
trained that
Like,
way. Yeah.
the
Yeah.
blank
A
screen.
cigar is
Well,
not just a cigar.
in trauma, we actually do use a lot of that method too, where you can't really like reflect your own, not personality, but you can't reflect your own opinions.
Feelings.
Or yeah,
Yeah.
you have to be very like objective when you're working with trauma because you want to provide that safe space for the client to really process and have like assign their own meaning to what happened to them. You can't just be like, oh, that sucks, like yeah, you know, because everybody else is gonna do that,
Right.
and it kind of takes away from their own voice. Like you want them to be able to like come up and assign their own understanding of what happened, reprocess that. So yeah, when you asked us for our modalities, I was like, okay, I generally like lean into existentialism. As you can see, I kind of lean back to that always. But yeah, it's a mixed bag. Like we have so many tools that we're learning throughout. I use hypnosis. I use yoga, you know, like movement, just like, you know, the touch. You know, we have to be really careful with touch in session, even though I got that sexy voice. But we try to like, you know, obviously be respectful of clients, and sometimes touch is not okay, and that's fine. But you know, we have to adapt, and like sometimes just like that, like little bit of a hug, you know, or like a hand on the shoulder, you know, to like say, are you okay? You know, let you know I'm here, bring you back down, ground you. All of that is really important too.
And just to piggyback off of what you were saying there, I think the blank slate is so helpful in some instances, but I also think that, at least in my experience with trauma specifically, so many people have learned to be dismissive of their trauma, or consider it not a big deal, or consider it not like it didn't affect them. And sometimes seeing your reaction in this space, right, where you can say, I'm so sorry that happened to you, or you respond like in a human way, like that's awful, you shouldn't have had to go through that, I think helps them kind of click into maybe this wasn't normal.
Yes.
Right, because I've had so many clients that are normalizing these really traumatic experiences from childhood that we're like a few months in and they're like, yeah, my normal childhood where all of this awful shit happened. And I'm like, you know,
Is that normal?
yeah, let's backtrack a little bit. Let's dive into that again, because it really, truly, sometimes the way that we cope and the way that we survive, and I tell them all the time, like, there's nothing bad about this. Like, you've made it this far thanks to being able to compartmentalize and kind of dismiss that. When you were a kid, you couldn't process that kind of emotion, and it saved you to be able to kind of be a blank slate and pretend it didn't happen. But that's not serving you anymore. So we gotta, you can cry it out now. You can process this. So I feel like sometimes the blank slate is important, especially in the very beginning. But then I think sometimes it's really helpful to bring in like a human reaction.
I agree. Kind of like a wiser, mature, healthy reaction.
Exactly. Yeah. Exactly. Just like that brings about like a hey, this wasn't okay.
Right. Like a just confirming belief of what they have.
Yeah.
Now we're talking about modalities, but what I also want to offer the listeners is we come at this as different people. So I think we can't help, as we're saying, some of that sort of normalizing and being like less blank slate. Like we bring ourselves into the room, and when you're sitting across from your therapist, you need to feel comfortable with them and them as a person, right? Like you're not looking at the pedigree and the resume. It's like, do I feel safe with you? Do I like you? Do you remind me of somebody I want to talk to, right? So let's just, for the folks that can't see us on camera, or just for the folks that don't know us, and we're going to go around and say, I am 46-year-old. I am a married Caucasian heterosexual male. I have been practicing therapy for about 20 some odd years. Started clinical work in 2001. My first session was September 11th, 2001. It was a hell of a first day.
Wow.
Yeah, that was something.
And you worked at the North or in Louisiana?
And so, yeah, I did my training. Yeah, I was in upstate New York doing my PhD.
Wow.
I have a PhD. I skipped the master's. And I've been in and out of my own therapy since I was about 15. So whatever you'd call it, 30 years. So I've had so many different experiences of my own with therapy, ranging from like warm older guy with a beard and like a cozy book kind of room to intense female putting me through transpersonal therapy where we used plant medicine and we explored like the meaning of life, and I've kind of touched on it all. Right now I'm trying to work on somatic therapy, both to learn for myself professionally, but have it done on me where it's like almost Reiki and it's almost energy work, but it's also a little bit of like the body keeps the score trauma stuff. So that's like what I'm bringing into the room as a person, as a human. What about everybody else?
Super cool.
How does maybe the you-ness affect what you're doing?
I'm like the most newbie here. I graduated in 2023. This was a career change. Bianca Gabay here. I am a white, heterosexual, cisgendered, Jewish, South African, with all the blind spots and privileges possible. So I bring to this work a lens of different careers. This was like my third career. All within the helping profession. I did my undergrad and then my master's in nutrition and dietetics. Became a mom and never practiced that with anyone other than myself and my family. And then I dressed women as a stylist with my mother for 12 years. So
I love that.
I did a lot of retail therapy with my clients. I guess there was some probably
You could use so much
therapy
right.
for
Yeah,
sure.
that comes
For
in.
That's
sure.
amazing. Nutrition and
That's right.
styling.
So all within the helping vein. And then through my own therapy, in and out of therapy probably since I was 18. But really, after being married for about 7 or 8 years, I was like, what the fuck? What did I get myself into? I need some help on this. And through my own therapy, I was like,
God, other people need this, and I want to be able to give back. And in my privileged life, I was able to go back to grad school and become a therapist. So I'm pursuing my hours right now, and about, I don't know, half a year shy of becoming licensed. So
Woo,
amazing, super
Yeah.
exciting.
Yeah.
So that's huge.
You go ahead.
Okay,
Tiff first.
Tiffany here. Radio voice. I am 37 years old. I am a licensed mental health counselor. I've been licensed for about 5 years now. Working in the field for about 7 or 8. I started in working with trauma right off the bat, like similar to Gabby. Worked in the Trauma Resolution Center, which they did everything, from domestic violence, women's shelters, um, men, women, children, anyone who underwent anything. The way that I would define trauma is anything that overwhelmed your normal coping capabilities in the moment. So I did a lot of psychoeducation, like teaching clients, and then using brain-based strategies to help them reprocess in a safe space. It was very like you know surprisingly quick work, if you will, like only 20-30 hours. And we would see some major shifts in people, being able to really talk about their traumas and not become emotionally charged as much as before, and even like take away like meaning, and shift their whole perspective on their lives and their survival. um, I still have clients that reach out to me today, just, to check in, which is the most rewarding thing, to like be able to like know that you made such a difference, and that they can like live and not be defined by that experience any longer. Um, and then now I work here at Coral Gables Counseling Center in my own private practice. I'm starting to incorporate hypnosis, which I'm really a big fan of. It is such a
I love it. I throw all my people at it.
Yes, I love it. Thank you. Yeah, it's a cool perspective in the sense that it's a little bit away from the traditional talk therapy, which I think throws some people off, where they're not really able to logically connect to like what's going on with them. So through hypnotherapy, I get to remove some of that, blockage, and like really get to who they are, and what's going on underneath the surface. Like recently, I had a client that she was like sharing, that she has a constant waking up with like tension in her chest. And every time we do hypnotherapy, it's the first thing that alleviates, and without even me really targeting that. So that is the one of the coolest things. So I really love hypnotherapy. And then I'm a certified yoga teacher, so I incorporate a lot of that yogic philosophy, as well, when I talk to clients, and helping them like re-understand what movement looks like. It doesn't have to be this crazy, fitness journey of I gotta look like a, weight training supermodel. And it's more of like what feels good, like what makes you release those endorphins, and just makes you feel happy in your body and flow and alleviate pain and tension. That's my approach. So yeah.
Can I just jump in really quickly?
Yeah.
I'm 40 years old. I wasn't shy to say my age, but
As a career change.
I love it. Okay, dive in.
Yeah, your turn, girl.
I'm Gabby, Gabriela Reyes, if someone's mad at me. And I'm a licensed marriage and family therapist. And so I've been working, like I mentioned earlier, here at Coral Gables Counseling Center for like 15 years now. I think it's 15 years this March. And I've been licensed, I want to say, for 6 or 7 years. I should probably know this, but it all blends together. And practicing for about 8 years. And I love it. It's what I've always wanted to do since I was a little girl, which is why I started working here when I was like 20. I'm 35 now. I don't remember if I mentioned that. And I am in a committed relationship. We're not married, and I'm pregnant. It's really spicy. But it's wonderful. I think that I was able to accept this really beautiful, wonderful relationship thanks to all the years of therapy that I went to. I mentioned it earlier, but I saw my therapist since I was 20. I think I did like weekly for 5 years, right?
Mm-hmm.
Massive daughter.
No, I know your history.
He was there.
Yeah.
So I think I saw her weekly for like 5
I
years.
wasn't her therapist.
No, he was not. He was not. But I did babysit his daughter for many years while I was in college, and she's the cutest thing ever. So I saw her,
or the therapist's daughter.
not my therapist's daughter, right? Todd's daughter.
Boundaries.
Yes. So, and then since then, I see her whenever I need it. I really do go back. Like anytime I'm feeling anything, my partner Chaz, he's like, babe, should I go to therapy? I'm like, I think everybody should go to therapy, but he's like such a happy-go-lucky dude. I'm like, you could go. I'm not certain that right now is the time where you're just like thriving and having, like living this wonderful life. You're just gonna go chat. But I think everybody needs therapy. That's just my opinion. I don't know how you guys feel about it.
Agreed.
We're all in the same boat.
100%.
And so let's touch on that because that's come up a few times in here, right? That like to people listening out there, you don't have to have a crisis. It doesn't have to be that like you get to a breaking point. That sometimes I tell everybody, what would you rather? Would you rather make an appointment to bring your car in for service 3 weeks from now and waste half a day and get your tires rotated? Or would you rather have your car break down and you're like, oh shit, now I need it? Dude, like it's the same service, but it feels very differently if it was proactive and planned. And so like it's okay to get ahead of it once you start feeling that first little symptom, that little something. My wife now knows my pattern. I didn't say that earlier, but I'm a big guy on patterns. I make my patients keep logs and diaries and records of, I want to know what happens for you at home. Somebody was talking about the nighttime routine. But my pattern is that whenever I start something new, even if it's great, new job, new house, new kid, my wife looks at me and she's like, you freaking out yet? Is this the part? Because you're going to freak. We know you freak out. It's coming. So when I know I'm about to buy a new house or start a new job, I start therapy again because like we know it's coming. I spent 9 months in therapy getting my shit together before my daughter was born because I was like, hey, the clock's ticking. Don't screw this up. Like I'm gonna, but let's do a little better. So proactive. We're getting ahead of it. Even Chaz could use therapy because he's about to become a dad. So there's a shift there coming.
Yeah.
Even if he's happy.
Yeah.
I'm happy and anxious all the time.
Yeah. Same, aren't we all? But I love reading. I read constantly. I love a good romance, and I actually bring that into therapy a lot. I think Raquel, my therapist, and romance novels are what helped me have a good relationship.
Shout out to Colleen Hoover.
And all the rest of them. We love them all. But I do believe that, kind of immersing yourself in happy things makes a huge difference in life. Like if you choose what you look at, what you read, what you consume, especially social media, that's something I bring into therapy constantly. Like let's trick your algorithm. We're not gonna stay looking at these photos that make you feel less than. We're not gonna follow these pages that make you feel less than. We're not going to follow these pages that make you think everybody cheats. Like we're going to do better. So it's something I work on a lot in my personal life because social media is addicting, man, for everyone. And so we take breaks, we trick the algorithm, and yeah, I think that's something super important to do.
Absolutely. And then to touch on the therapy thing, it's what I always tell my clients too is that therapy or finding a therapist is kind of like dating.
Yep.
Right. And that you're not going to hit it off necessarily with the first one. I mean, if you're lucky enough, great, keep going. But yeah, my therapy journey, like I went mostly after having my son, which I had a kid 8 months ago. So that postpartum is real, right?
Yeah.
Where you start to like question everything and you need to like have someone outside to like objectively chat, and kind of like run through stuff that comes up for you. And so unfortunately I haven't like found my Raquel.
Yeah.
But it's like a journey. Like every therapist has their own unique approach and way that they bring to you. So it was helpful. It wasn't like a waste of my time, but it was, it's something that everyone, you have to like, don't get, what's the word? Like, don't allow it to
disappoint
you or
don't give up on the process.
Don't give
up,
right?
on
Yeah,
the
it
process.
really is like dating, and that you just haven't found your match or your fit.
Right.
And to that point, I should also say to those out there in listener land that sometimes the best recommendation comes from friends because you're like, okay, we have similar interests or similar personalities or similar values. So who's your therapist?
Mhm.
The caveat that sometimes I won't treat friends. I definitely have big boundaries around treating family members. So sometimes that sucks that like you want to see your friend's therapist and he or she says, well, I can't because I know that you know this other person. But always start there because I mean, that's who you want to find your future partner, right? Like you want it. That's what Hinge started as. You know, does
Yes,
everybody remember that? The
Yeah.
Hinge was supposed to be that we share a like a bending
Right.
point. We share a person.
You can steal Raquel.
Okay.
I mean, borrow her. I want her back eventually, but feel
Different
free.
days, different seconds.
Uh-huh.
So I'm aware of the time, and we all have to get back to giving therapy services. So let's wrap up this very special crossover episode of Therapy Without the Couch and the Counseling Corner. I want to thank Gabby and Tiffany and Bianca for coming out. I hope that the listeners got a sense of there's different ways to do therapy. There's different therapists. Even if you liked one of our styles, you might not have liked the way we talked on this podcast. And so that's right. Like you got to find that kind of overall match and keep on looking. But it's more than just a degree or a certification or a resume. Like it's all these factors that go into who we are and how we provide the services we do. And we hope that we'll each see one of you on our couch soon.
Yeah,
Till
thank
next
you for
time.
having
Thank
us.
you.
Thank you.